We have been working for many years, I will tell you, on legislation that calls for us to be able to develop and implement programs on workplace violence prevention. That is a basic tenet. As you hear from the nurses today, in their fight for health and safety for their patients, for health and safety in their work environment, I want you to know they do not stand alone. My colleagues and I are working to make the very environment in which nurses are working healthy and safe for the nurses as well. Thank you.
In observance of National Nurses Week, we're releasing the results of the State of Nursing in Massachusetts, our annual survey of more than 500 registered nurses about the state of patient care and nursing in the Commonwealth. The findings are very concerning, with more than half of the nurses reporting that the quality of patient care has gotten worse in the past 2 years. As nurses, we know how to roll up our sleeves and get things done. This past year has served as a reminder of how often our society asks nurses to do this under the most extraordinary circumstances. This year, what nurses really want is not pizza or flowers or accolades. What we would like you to celebrate National Nurses Week with is safe staffing, with workplace violence prevention, with occupational presumption, and with the protection of essential services. Celebrate Nurses Week with real action on the issues affecting patients and nurses at the bedside. Thank you very much.
We surveyed nurses in all types of healthcare settings across Massachusetts, including teaching and community hospitals. Our survey hit all age ranges as well, and most nurses were not MNA nurse members. When it came to hospital quality care, 55% of the nurses said it is getting worse, compared to only 10% who said it is improving. Nurses regularly have unsafe patient assignments, not because hospitals do not have the money to hire nurses, but because executives choose to staff at the absolute minimum. This National Nurses Week, we are not asking to be called heroes. We are asking healthcare corporations and our elected officials to listen to those of us on the front line. The best celebration we could ask is for real, lasting changes that improves patient care. Thank you.